It's my feel-good breakfast show.
Enjoy.
You're still locked in, of course. Yes, it's your feel-good breakfast show on Travel Tuesdays. But before we do, we're looking at your internal health now. From the 7th to the 11th of September, it's National Kidney Awareness Week in South Africa. Now, what this means is the week is aimed at driving knowledge about prevention and early detection of kidney disease and failure, as well as the importance of your kidneys for survival. Now, joining us this morning to answer questions and common questions on the kidney health, please can I welcome Nephrologist and Specialist Physician, Dr. Geoffrey Bihl. And if you have any questions, of course, lead to the man and let us know on social media, because we've got everything coming your way. Doc, how are you doing this morning?
Very good, thanks, and I appreciate the invitation. Good morning to all the viewers as well.
Thanks so much for joining. It's been great getting to know you kind of in between segments here. Clearly, this is a vitally important conversation to be having, but let's start at the very beginning. Kidneys, their function, why are they so important for us, and why is it vital for us to have a Kidney Awareness Week, do you think?
I think it's a very good question. The most important thing, the kidneys are the filter of the body. If you equate the body to a swimming pool, they keep the pool blue. They keep the level of the water correct, they keep the pH so you can swim nicely, they keep the temperature, the amount of colour, they keep that too, they manage that, but they're silent organs. So what I mean by that is they don't breathe or beat or think or move. So you might not know there's a problem. If you've got an underlying condition long-term, particular things like diabetes, high blood pressure, once we get a little bit older like me, and congenital genetic history in the family, that would put you at risk of your kidneys causing a problem. Another important factor is that kidneys give very few symptoms when they're failing. If you have an infection or a kidney stone, that's something different. But when they're not working properly, it takes a very long time for a patient or a person to get any symptoms at all, and often only when the problem is advanced. And that's why prevention, and it's why an awareness like this week is to get people just to think about it. They've never thought about what the kidney does or what it makes. I don't want to say that on TV. We all do that our whole lives. And people aren't really aware of what that means. Kidneys filter about 200 litres of blood an hour. An hour. At least, sorry, 24 hours. So we only make about 2 litres of urine. And therefore the kidney reabsorbs 199 of those clean fluid and back into the bloodstream, and in that way balances all the parameters that it needs to.
The hardest working organ in the body, man.
Sure. Well, one of the main functions of the heart, as an example, is actually to pump blood to the kidneys. Don't tell a cardiologist that.
Now, Doc, look, you've got my ears raising when it comes to the fact of kidneys and its importance, but you mentioned earlier there's some issues where there could be problems with your kidneys. So how do you actually know?
So what are those signs?
Yeah, like what are the signs of kidney issues, disease, maybe failure? What should I be kind of looking out for, being aware of?
Sure, and that's another good question. The major symptoms of kidney problems only really develop once you're under about 60% function.
Okay.
So before that, it's important to realize, as I've said, you've got an underlying condition. Not really going to notice anything physically until it's advanced, but probably the most important things is blood pressure. You don't necessarily feel your blood pressure, but when you're at your doctor or at your clinic or wherever you are and there's availability, even at the pharmacy going for a screen, you'd be able to check on blood pressure. That would probably be one of the first things that you would find.
You're saying, Doc, if I do have blood pressure, that's a concern, and it could be related to kidneys.
Sure. So, yes, if the blood pressure is very high, it can cause kidney problems because you've got a high pressure going through the filter. But if your kidneys aren't good, it will put your blood pressure up. It's a side effect. So when you go on a general screening, and why we want the awareness of kidneys is patients often, and people know about cholesterol, and they know about smoking, and they know about diabetes, and those often need a blood test. Whereas to test the kidneys, it needs a simple, inexpensive little thing we call a dipsticks. You pee in a little bottle, put a dipsticks in, that measures 10 different parameters, probably costs 20 cents to 30 cents a test, and if that is clear, your kidneys are okay for all intents and purposes. So once things become a little bit more advanced, then if you go back to your pool model, either there's too much fluid and you start to swell, or the color of the pool has turned green and you start to feel ill, flu-like symptoms, appetite's going down, you might lose a little bit of weight. Again, none of those are specific, but if you've known you've got an underlying condition, particularly the big five, then, as I've mentioned, then you need to be aware, and you should check the urine with a little dipsticks at a pharmacy, at a clinic. It's in every doctor's rooms.
Yeah, made it really easy. So you've explored the relationship between hypertension, that dynamic kind of relationship. And I know you mentioned there is a genetic element involved as well. What causes kidney disease? What would be causing? Is it lifestyle elements? What are the things that feed to ill health in kidney?
It's an important, and particularly in a country like South Africa, we've got a lot of other issues, and particularly from a health perspective. And I would say the biggest two are hypertension, which you can have primarily, that damages the kidney, and the second main thing is diabetes.
Okay.
So diabetes is actually a blood vessel disease. It's your sugar that's damaging all the little blood vessels, from big ones to small ones. The kidney's full of blood vessels. Now, we know that, and a lot of people are aware of heart disease and strokes. Well, those are also blood vessels. So if you've got a heart disease and you've had a heart attack or a stroke, you might well also have kidney problems and not even know about it. So the hypertension and diabetes in our country, HIV, we've been pleasantly surprised. I don't know if you can be anything pleasant about HIV, but we have not seen the numbers in kidney failures that we were expecting when the HIV first came out, because it can affect your kidneys directly. And it's something that is definitely part of a screening test in people who have got HIV. Then if you've got a family history, would be another important thing, because genetic conditions can happen in any family. Again, an unusual cause, but certainly there are a number of genetic problems. And quite interestingly, from a developmental point of view of kidneys developing even in the womb, unusual development and unusual shapes, sizes and numbers of kidneys are the commonest genetic conditions that you get. So most people have got two kidneys, a few have got one, and different sizes and shapes, but as long as it's working properly, that's what's important.
So much that we can still explore. In fact, we're going to do that. Doctor, thank you so much for joining us. We're going to continue the conversation. We're going to take it live on Facebook at 10 minutes past 8 this morning. Dr. Bihl is going to stick around to answer any of your questions, so please connect with us on Facebook right now. Post those questions and make sure you stay tuned on Facebook Live at 10 past 8 to continue to explore the incredible array of functions of the kidney, but I'm also interested in what is going to feed into a healthier renal diet and what we can do to better equip ourselves to stay healthy. And then, of course, Riley's going to help us with a bit of a workout, but you need to go get changed.
I need to get changed. We're going to be doing a workout that's specific to anybody that does have any kidney issues. So it's going to be light, but it's going to be perfect for those gains. So stay tuned for more.
It's my feel-good breakfast show.
Thank you so much, brother. Dr. Geoffrey Bihl, who is a nephrologist and specialist physician, has opted to stay on. So thank you so much, Doc, for joining us.
Here.
Over a very important time, I think, for your field, yes, but I think for all South Africans to take cognizance of how important our kidneys are for our general health, and how we can maintain a healthy kidney, yes, but also some of those warning signs, or possibly, as you mentioned, the comorbidities that feed into us having a knowledge of the state of our kidneys. And we've got a couple of questions coming through from our viewers, so thank you so much to them. I'm going to ask them to bring them up on screen so we can have a squiz there. This one coming in from Lutabo: I often have severe sharp stabbing pain on my lower abdomen. So should I worry if I may have kidney stones, and how do I know if I have kidney stones? We haven't touched on kidney stones at all. So what is a kidney stone, and should she be alarmed?
So kidney stones are fairly common. About 10% of the population will develop a kidney stone at some stage. And it's mainly related to the overexcretion or production of calcium inside the kidney. It causes a tiny little microscopic stone at first. And then for various genetic and biochemical reasons, that stone starts to grow. And it's a stone because it's a stone. Calcium is usually in bones. You don't really want it sitting in your kidney. To answer that question specifically, it would be unusual to have kidney stones causing lower abdominal pain.
Okay.
Kidneys are at the mid part of the back on either side, but a bit higher than people think. Typical pain from that would be radiating from the back down into the pelvis rather than in the pelvis particularly. Usually they run in families again, a history, and it can be at any age, but with that particular question, I'd be surprised if it was related to a kidney stone.
Would you, I know without having the patient here to go through your process, what would lower abdominal pain, what could that be an indication of?
Yeah, so if we're just sticking on the kidney and urine production, probably the lower abdomen we'd think along the lines of the bladder, perhaps an infection, and I think that was a female person asking the question, so obviously that side of things would be needed to look at too. I won't go into specifics there.
See a doc, see a doctor. We've got another comment coming through here. You've spoken about diabetes and how that as a comorbidity can have an effect. Does diabetic medication damage the kidney? That one coming from Kim Delia.
That's also a very good question, and we need to be very careful in people who have got a kidney problem and what medicines we prescribe. Just on the side, those medicines are anti-inflammatories, are particularly bad.
Okay.
Not often used in diabetes, and to answer directly, no, the medicines do not damage the kidneys.
Right.
And in fact, there's some new medicines for diabetes which work specifically on the kidneys and then lower and reduce the morbidities, in other words, the side effects of diabetes. So actually using the kidney to treat diabetes. And how that works is it blocks salt retention. So the salt goes out the kidney, lowers your blood pressure, and sugar follows. So we used to say if you're diabetic and you have sugar in your urine, it's not a good thing. Well, now we've learned that actually it is a good thing. And the latest medicines encourage the kidney to excrete sugar and therefore control the diabetes.
When you mentioned over-medicating as being a dangerous area, what sort of medications are harmful to the kidney?
Well, certainly we discourage over-the-counter medications. Most doctors who prescribe medicines will be aware that the kidney is an excretory organ and will need to get rid of those medicines. But probably the commonest we need to be careful of are anti-inflammatories.
Okay.
A lot of those are over the counter, certainly a couple of days if you've really got a lot of discomfort, but long-term usage of those medications are really damaging to the kidneys.
How do we then promote a healthy kidney? What do we need to be doing when we talk about a good urinary diet? What do we need to be doing to ensure that we have the healthiest possible system?
So I think what's important is, and you know, it's easy, it rolls off the tongue easily, is to be healthy. Most important things is, if you are overweight, is to lose weight. There's a significant risk of kidney problems if you are a larger person. If you're a smoker, similarly to heart disease and lung disease, strokes, cigarette smoking can definitely worsen kidney issues if you've got one already, and even precipitate them sometimes. I would say the less salt, the better. Recommendation is somewhere between 1 and 5 grams. That's about only half a teaspoon of salt a day. And if you can avoid salt completely, both of those, that will bring down your blood pressure a little bit. Good aerobic exercise, as we saw a little bit earlier, and I did offer to take part, but wasn't allowed to. And so good 3 times a week, good regular exercise would be important.
Stick around. Raul's going to be hosting another session now. We'll open
I brought my lycras in case.
I've had a couple more questions come through here. Luann Barrett asking, if your kidney is working at 40%, it could mean what for you? Question mark, question mark.
So the levels of kidney function, obviously 100% is normal and 0 is 0. And depending where you are on the scale, it's classified into different categories. That would be, where she is at 40 would be about a category 3. Generally in that setting, there aren't many side effects. As I mentioned earlier, at less than 30, 20 to 30, you'd start getting symptoms. But it would mean, because your kidneys aren't working properly, as we spoke about earlier, your pool isn't crystal clear anymore. It's a bit murky, but you can still swim. In other words, you can still continue your life normally, but you need to be extra cautious about your blood pressure, salt intake, over-the-counter medications. See your doctor regularly who needs to monitor where the kidney is, and try and avoid other precipitants and the other things that can cause that kidney function to go down. A large one would be dehydration, particularly in our environment. And you were asking about how else can you protect your kidneys. A common question we asked is, well, how much fluid should we drink? I think that the body will tell you if you're thirsty.
Okay.
To aim on a specific volume and a specific amount of fluid every day is very difficult, and most of us will take in the right amount. Importantly, though, on that is do not dehydrate. And this is particularly when you're exercising. If half an hour 3 times a week, or if you're someone who regularly exercises and even professionally exercises, your level of hydration is critical, and that would be another way, an important aspect for that person to monitor their kidneys.
Read your body. I'll see if I can stump you with one last question. And Paul saying, morning, I'd like to know, is it normal for urine to smell like coffee after drinking coffee?
That's a good question. It's a lot of things are excreted in the kidney. As I mentioned earlier on the show, 200 litres per day are filtered, and coffee is a diuretic. So coffee will make you pee more. About the actual aroma of it, there are lots of different aromas. It would be unlikely.
We're not talking about asparagus here.
Yeah, no, it's also a genetic thing, by the way.
I know.
Not everybody, yeah.
Absolutely a brilliant endorsement for Kidney Awareness Week, so thank you so much for joining us this morning. This really has been an eye-opener for me, and I have a newfound respect for, as you say, the silent, vital organ that is playing such an important role in our body. And we've got one more comment that we'll sneak in here, a comment or a question to Ali Love saying, if being born with one kidney, does it mean you can't do sports?
Good question. We're not really sure why we've got 2 kidneys. In fact, when a fetus in the mother's womb, we've actually only got 1. And slowly, as the fetus grows, it splits into 2 and passes up towards the backside, not the backside, to the back of your back. And but we're not sure why it does that. So if you're born with 1 kidney, as I said earlier, about 10% of the population only have 1.
Anyway.
You will be able to play sport. I'd probably try and avoid major contact sport. And it was a lady asking the question, so rugby would be unlikely. And riding off-road motorbikes, those are probably the only 2. Otherwise, yes, you could live a normal life, and that kidney will manage. It will grow bigger than 2 kidneys, so it will take over function, and you would expect a normal lifespan with that.
Because the body is a marvelous
The body just
tool.
adjusts and
really
manages.
Is amazing. Thank you so much for opening our eyes today and joining us. This really has been a treat. Thank you so much. And hopefully that's answered many of your burning questions this morning. I think ultimately the most important thing is to stay healthy. I know it's easier said than done, but let's see if we can help you along that path with a little bit of a fitness routine. I see the neon is out, the guns are out. Let the gun show begin.